Hello, watching NewsFirst Prime. I'm Rahul Dayan. Today we are here at Path to Parenthood event organized by NewsFirst in association with Garbhagudi IVF. And today I have with me Dr. Lavanya, fertility expert who focuses mainly on such issues which the new generation couple are facing at this point of time. Hello, ma'am. So you just mentioned about very valid points on stage, saying that the current lifestyle of the new gen couple, be it smoking, alcohol, or any other kind of a habit which they have inculcated in their life. So those habits are affecting directly or indirectly on the. It's taking a toll on their fertility health. So this event emphasizes and it throws light on such kind of a very important issue, which I think more people do not come out in the open and say that yes, I am facing such issues. So how important is path to parenthood for such kind of a new generation couple facing such issues?
Definitely, I think I would acknowledge that this is a wonderful initiative, first of all. And as far as I am aware, this is one of the first event that media people have taken to connect the working healthcare professionals to the public. And that is what impressed me when they asked me to be the speaker and the opening keynote speaker. And like you mentioned, imagine, we all doctors, the healthcare professionals all together, we are exchanging knowledge. We have access to international faculties, national. We are exchanging knowledge and we are sharing it within our own society of doctors and definitely replicating it to the patients, but it's one on one. A platform like this where you are trying to reach many more public. Imagine you have such a big crowd here, you're reaching out to people, and we know we are going live, and then we have a lot of people watching. Definitely, it's a great initiative where at one point you have all the healthcare workers here, healthcare professionals here, trying to reach out and give wonderful message, and I think that's very important. Now, simple thing like you said, smoking, alcohol definitely has an effect because it is going to reduce the oocyte quality, the number, the sperms are getting affected. And here we are talking not only as a fertility specialist, we also have obstetricians here, we have Ayurveda doctors, we have allopathy doctors, we have nutritionists, we have yoga therapists, we have fields and healthcare professionals from different perspective and different verticals trying to reach out and give good news.
I'm just giving you a vague question. I'm just asking you this question. So out of 100 couple, if you survey at this point of time, what according to you, what will be the number of the couple who will be facing such kind of an issue out of 100?
I would definitely say there's minimum of 20 to 25% of couple who are fertility seeking at any point of time. Like I already mentioned in my talk that the conception ages and the reproductive age group is the same, but then people planning pregnancy is getting postponed for several other reasons. Only when they start trying. First of all, now they have lost the advantage of age by postponing their pregnancy. On top of that, they're also trying to push the pregnancy, and with the lifestyle changes it's affected, so that is going to be more problematic. So this is why it is going to be a problem, and we have to remember the problem is not only the female, it is also the male. 30% can be a female factor, 30% can be a male factor, 30% can be a problem with both of them, the male and the female, and of course 10% we say as an unexplained infertility where everything is normal or you have gone through a treatment, everything is good, but still you don't conceive easily, and 10% falls in unexplained infertility.
And just out of curiosity, is there any specific age, after which they find problem in conceiving, for be it for male or for female?
See, definitely there is. Like I mentioned, age is one important parameter. All women come with a fixed number of oocytes. Oocytes means these are the eggs. There are limited number of oocytes or the eggs, that is 400 in a life cycle of a woman. Every month one gets exhausted. Some of them exhaust much faster, some of them exhaust a little later, or the menopausal age group is anywhere between 45 and 55. But we are seeing the couples have started planning, women have started planning pregnancy at 35. Now the quality of the eggs after 35 years can be deteriorating. The number of eggs that you have is also much lesser. So you have a problem conceiving. So this leads into delay in the conception. So increase in age also leads into something called as a Down syndrome. What is Down syndrome? It's something to do with mental retardation. All these risks are very high. Coming to the male may not be much of a parameter, or the age is having a direct effect, but definitely it does cause a little bit of change. So it is a combined age that we need to calculate and take.
Oh, I think that was a very useful piece of information which you just shared with our viewers. And I think this is just an example of what you would get out of Path to Parenthood event or the summit which is going on in the Palace grounds, Grand Castle Gate today and tomorrow in Bengaluru. Thank you so much, Dr. Lavanya, for talking to News First Prime. With camera person Manju Hoskote, this is Rahul Dayan for News First Prime, Bengaluru.